We have 14 hospitals in Leprosy Mission Trust India, and I had the health program of those 14 hospitals, seeing what they do, how they perform, what are their needs. India still has around 59 to 60% of world leprosy in our country, and out of that almost 8% of them were child cases. There was around 2,500 reconstructive surgeries that we do for people affected by leprosy in India. See, leprosy is still a disease of stigma and discrimination in our country. If you have leprosy or you're diagnosed with leprosy, people start avoiding you. Even it may be your own family members, the community. Leprosy is curable. First, people have to be aware. Awareness has to come both at community level for the patients, even for the healthcare providers, that there is a disease called leprosy. It's still prevalent in our country, and it is curable. And they should also know, the healthcare providers should know what is leprosy, how to diagnose, how to treat leprosy. And people should come early for treatment, because if they avoid early treatment, it's treatable. But again, because of stigma and discrimination, people are afraid to come early because they are worried that people may come to know about them. So people have to accept them, and as awareness grows in the community among people, then you know that this is not a disease that you really need to be afraid of or scared of, and that can be cured. Our hospitals, most of them are 100 years old, some of them are 70 years old. So we need to renovate them. There are broken walls, broken roofs. So we need to rebuild them up, because we cannot expect money to come from the patients, because people we serve cannot pay for the services. I think we need to also upgrade the equipments that we have. Many of them are old, and then you have new healthcare providers, new doctors coming. They also need new equipments and all. And then I think we also need medical cost and medical treatment. India is also becoming very expensive slowly. The amount that we put in for each services that we provide is become costlier than before. And then of course it would be good if some support can come for research and advocacy, which in itself is not so obviously visible as a medical care, but which makes an impact in the global and the national level. I think those are the areas where we really need support.